Hi everyone. Good to see your names virtually. My name is Jessica González-Rojas, and I am running for New York State Assembly in the 34th Assembly District, which includes the neighborhoods of Jackson Heights, East Elmhurst, Corona, and Woodside. And I'm incredibly humbled and grateful to be able to present this webinar on a crisis that we're all dealing with right now. It's very unprecedented, unsettling, and we're all sort of in a new way of life right now given the coronavirus. So I'm thrilled and excited to share with you a wonderful speaker that we have from the community. But before we get started, I want to share some logistics. Folks are automatically muted, but we encourage your questions. So after some time of Dr. Epstein's presentation, we're going to have a chat button available. And along the bottom, there's a button that says chat. So you can type in your questions. And we have a lovely moderator, Mia, who can pose those questions to Dr. Epstein. Or if you click participants on the bottom, and then on the right-hand side, there's a little button that says raise hand. If you'd like to speak, we can also raise your hand and we can turn on your video and everything. Again, everyone's video is turned off for streaming quality. We know sometimes these things get slowed when there's a lot of video. And we'll be recording this and posting it on social media, but we plan to translate it and offer subtitles in Spanish so that our Spanish-speaking neighbors can also get the rich information that we're going to share today. We also have a volunteer, who I'm checking if she's online yet, who will be live streaming, live tweeting, and we're looking for folks to hashtag JGR COVID webinar. So if you like to live tweet as well, hashtag JGR COVID webinar, so folks can find it. We will definitely wrap up by 9, so I'll be mindful of time, and our moderator will be mindful of time. But we really hope to be able to get to all your questions. So as I mentioned, I'm running for New York State Assembly, and one of the issues that is most near and dear to me is actually public health. I've been working in the public health field around reproductive health rights and justice for the last 13 years, and we certainly need a champion now more than ever, who's going to fight to ensure that folks have access to the healthcare that they need, despite immigration status, despite how much money they have in their pocket, their zip code, what kind of job they have. It's really, really important in this moment to ensure that folks have access to healthcare and that we have a important and a strong safety net to ensure that all our communities can thrive in this really difficult moment. So we are shifting our regularly scheduled campaign activities to really focus on mutual aid, checking in our neighbors. We're doing phone banking every night. So we'll share that information as well. And you can sign up for a phone bank to check in on our neighbors and offer mutual aid. So things are really different in this moment. And I'm practicing self-quarantining, only stepping out for really critical things like groceries. But I'm doing my best to practice an attempt at flattening the curve in this moment. So part of that is actually education, right? And knowing the facts, clearing the myths from the facts, and ensuring that we all have the tools to be able to thrive, take care of ourselves, our families, and our communities in this moment. So I'm thrilled to introduce Dr. Jonathan Epstein, and I'm going to read his short bio. It's super interesting, and we're just so lucky not just to have him on the program right here, but actually him as a neighbor in Jackson Heights and a fellow parent. So thank you, Jonathan, for joining us. Dr. Epstein is the Vice President of Science and Outreach at EcoHealth Alliance, which is a science-based non-governmental organization in New York City. He's a veterinarian and epidemiologist, and his research focuses on the ecology of zoonotic viruses that impact animals and people, particularly those associated with bats, Ebola, and recently the coronavirus, and that includes SARS, MERS, and COVID-19. Dr. Epstein also served as technical consultant for the World Health Organization, the World Organization for Animal Health, the Food and Agricultural Organization, and the Institutes for Medicine Forum on Microbial threats. I hope I said that right. He holds adjunct appointments at Tufts University, Columbia University, and Mount Sinai School of Medicine. Dr. Epstein has published his research in leading journals, including Science, Nature, PNAS, and Cell, and his work has been extensively featured in news and other media, including a documentary called Spillover, Zika, Ebola, and Beyond. So Dr. Epstein, we're super excited and very grateful to have you in this moment. So I'll turn it over to you to really share what is coronavirus so we know what the facts are. Where are we now? There's every day new information. If you could share the latest and what our community needs to know to stay healthy, and any tips and best practices for our communities to take care of ourselves, our families, and one another. So I'll turn it over to you. Mia, you could spotlight him and make sure his mic is off.
Thank you very much, Jessica. Thank you for having me tonight, and I really appreciate your effort to bring everyone together to learn more about the current situation, the epidemic that we're in, because to me, one of the most important aspects of public health is education and making sure that people understand the facts, which is going to help everybody be better prepared to deal with the situation. So thank you for having me, and welcome everybody. Good evening. It's also a pleasure to be able to speak to neighbors and friends and people within the community here. I wanted to really use the time, and I'm going to speak just for about 20 minutes or so before we get to taking questions and having some discussion, but I wanted to use the time to talk a little bit about the facts about coronavirus, what is driving this epidemic, the situation we're in, and then get into specifics about what we should be doing to reduce our risk for exposure and what we should be doing to protect those around us as well. Both are extremely important and go hand in hand. So just to begin, for a little bit of background, when you hear about coronaviruses, realize this is a group of viruses that are named coronaviruses because of their shape under a microscope, but it's a very large family of viruses. Almost every mammal has its coronaviruses associated with it, okay? Cats, dogs, people, cows, camels, very common. Birds too. So these are very widespread viruses. But until SARS, which was a coronavirus that we discovered in 2002 when it emerged in China, before that, there were really only 4 known human coronaviruses, and they were all responsible for essentially the common cold, very mild disease. And so they were never really paid much attention to. And then in 2002 came Sars coronavirus, which was really the first zoonotic coronavirus that originated in animals and caused fatality in people. Okay, the other coronaviruses also originated in animals back in time and now circulate among people, but SARS was the first one to really cause death in people. And of course, it caused a global pandemic as well, infecting 8,000 people and killing about 800. Now, it seemed like a lot at the time, although given the numbers we're dealing with now, it was really much smaller of a pandemic. And then in 2012, Midde East Respiratory Syndrome was the next zoonotic coronavirus that was related to SARS that emerged. And that emerged in the Middle East, in Jordan and Saudi Arabia, and it's transmitted from camels to people. And to this day, it continues to cause human cases, and that also causes fatality in people. So that was the second coronavirus emerging from animals just within a 10-year period that caused mortality, human mortality. And here we are today with the third one that also originates in wildlife and has gotten into people. And I'll go over a little bit about what we know about how that happened. But the truth is, we're still learning a lot about this virus as the outbreak is unfolding. Now, SARS emerged in live animal markets, which means it started in bats. And how do we know that? Well, this was some work that I was involved in, tracing back this virus to its wildlife reservoir. And it's carried by small bats that are very common throughout Asia, including in China. In fact, most coronaviruses that get into mammals seem to have their evolutionary history with bats. And so that includes SARS, MERS, and the current virus called SARS-CoV-2. So we'll start with that. The virus that's causing this current pandemic is called SARS coronavirus 2. The disease it causes is called COVID-19. So when you hear COVID-19, that's describing the respiratory disease that it causes. So these viruses come from bats. They've made their way into people in different ways. And what we know about this one is that it was originally first discovered back in December, so very recently, when we had a cluster of 40 cases in Wuhan, China, which is in central China, most of which had some association with a live animal market or a seafood market. Some of them had visited this market, others worked in the market, but the market was also known, excuse me, to sell wild animals, okay, for consumption. Now, when SARS emerged, we learned all about which animals were present in that market, and there was a lot of during the investigation, animals were tested and found to carry SARS coronavirus, and the people who sold and handled those animals were also tested positive and were found to carry SARS coronavirus. So a link was made between humans and animals, which is how we knew SARS was zoonotic. With this virus, we don't know exactly which animals were in the market that might have been involved in transmission. The reason we know this one is zoonotic and came from bats is because of its genome. So if we look at the genetic code for the SARS-CoV-2 that's causing COVID-19, it is 96% identical to its next closest relative, which we found in bats in China. So we know if we look at a family tree of coronaviruses, this one fits right in there with SARS, MERS, and others. Okay? But what we don't understand is the process by which it emerged from bats into people. Now, we think the market had something to do with it, and there's evidence for that, but there's still a lot of unknowns. But the important thing is it emerged in December, and it spread person to person. And at this point, it is continuing to spread from person to person within China, and it has traveled, via human travel. It's made its way to more than 100 different countries, and thus we have a global pandemic. So how does this virus spread? This is a respiratory virus. The disease that it causes has really three major symptoms. A dry cough, and that's because this virus causes a lower respiratory disease, which means it infects the bottom part of our lungs. So you don't get a wet, mucousy upper respiratory infection necessarily. It's more of a dry, non-productive cough, and it's typically accompanied with fever greater than 100.4 degrees. So cough and fever, and then people may also feel flu-y, achy, malaise, the kind of general yucky feeling you get when you're sick with the virus. That comes with it. You might have a sore throat, you might have some upper respiratory signs, but it's mainly the cough and fever that go together. Now, the good news about this virus is that the majority of cases, the majority of people who get infected with this virus will have mild or moderate disease. Okay? Most people will recover from this virus and be fine. 80% of people who get infected will have mild or moderate disease. About 15% will have severe disease that requires hospitalization. And 5% of people who are infected will get critical disease. And those typically are the people who die from this virus. And we know from the epidemiology, from looking at data, particularly out of China, where there have been more than 80,000 cases. Okay, globally, there's about 200,000 cases now. But we know from looking at the data out of China, the people that are highest risk for significant critical infections from this virus tend to be older people, and specifically older men with underlying health conditions. That could be cardiovascular disease, respiratory disease like chronic obstructive pulmonary disorder or emphysema. People who've been lifelong smokers are susceptible to this, and diabetes, because that's often associated with immune suppression or immune compromise. Now, the same would be true for people who are on chemotherapy because they're getting cancer treatment. They also are immune compromised, or other people who have autoimmune disease that are being treated with immune suppressive drugs. So anybody basically who has a compromised immune system is more vulnerable when infected with this virus and more likely to have significant disease. The virus is spread from person to person through droplets. Now, this is an important point. This is not an airborne virus. This is not a virus that lingers in the air, that if somebody were to sneeze or cough, say in a subway car, that everybody in that car would get exposed, or that you could catch it from across the subway car, even though it's a confined space. This is a virus that hitches a ride on droplets of saliva. So we call it droplet transmission. When you cough or sneeze, or even speaking very closely to someone, you visibly or invisibly spit tiny droplets of saliva, and that can carry the virus. And so it spreads within a range of about 3 to 6 feet. And that's the basis for why you're hearing a lot about social distancing, the idea that if we maintain physical distance between us and other people that can limit the opportunity for this virus to infect us. So that's how it gets out of our body. And the way that the virus gets into our body primarily is through 3 routes of entry: our mouth, our nose, and our eyes. And that can happen directly if we're exposed to droplets of saliva through our mouth or our nose or our eyes. It can also happen if we touch a surface that's contaminated with saliva and virus, and then we proceed to touch our face, which is also why you're hearing a lot about avoiding touching your face. And this is true for a lot of viruses, including flu and others, that you always have to be aware of when you're touching surfaces. And then you touch your eyes, you eat food, or you scratch your nose. All of these things can allow viruses to get into our body, which is why hand washing is so important, because that destroys any virus that might be on our skin. Okay, so that's how it spreads from person to person. And when we talk about how contagious this virus is, we look at the rate of transmission. And every virus, every disease has a different rate of transmission. It's what we talk about it in terms of how contagious it is. This virus seems to be spreading in a way that we refer to as its reproductive rate, or R0, you might have heard of, which is 2 to 2.5. What that means is for every person who's infected, they will go on to infect 2 to 3 other people. So if you do the math, you can see how very quickly it spreads and you get exponential increase in the number of cases. Now, the important thing to understand too about the rate at which a disease spreads is that it's very contextual. It matters in terms of the environment that you're in, which means that if nothing is done to protect people, the virus will spread to those who are susceptible at that rate. But when you have public health control measures like social distancing and hand washing, when you start doing things to reduce the risk of spread, that rate goes down. And that's good news, because that means we can control how infectious this disease is by our own actions. And the goal in public health with infectious disease is to drive that reproductive rate, that R0, below 1, which means that every person who's infected infects fewer than one other person. And if we can do that, the virus will eventually disappear. So when you hear an expression called flattening the curve, which you may have heard of, that refers to the epidemic curve, which is the rate of spread of the virus. If you literally think of a graph where people are getting, more and more people are getting infected faster and faster because of this exponential spread, you get an explosive outbreak if nothing's done. And eventually, though, the virus will run out of people to infect. Everybody's either been infected and they've recovered and now they're immune, or some have died, but in any event, there's nobody left to infect. So the outbreak tapers off and you start to get a decrease in the number of cases. This would happen naturally even if we did nothing. But when you have a very steep curve, when you have an explosive outbreak like now, where people are rapidly getting exposed and infected, you have a tall curve. That means you get a lot of cases in a very short amount of time. With all the public health activities and controls that we're trying to do to reduce the speed at which people get infected, that effectively decreases the steepness of the curve and the height of that curve. Flattening the curve means you might have the same number of cases, but it's spread out over more time. And that's good news for a hospital system, for a public health system that will quickly be overwhelmed by, say, 1 million cases in 1 month versus 1 million cases over 18 months. And it makes a difference in terms of control. And I just made up that number, but to illustrate the point. So that's when we talk about flattening the curve. That's the goal of trying to slow down the spread of this virus. Now, for those who get infected, you don't feel sick right away. We have what's called an incubation period, which is the time from when you're exposed to the virus to when you start to see symptoms: cough, fever, achiness, okay? And on average, that's about 5 or 6 days, but it can be anywhere up to 14 days in as little as 2 days. So the incubation period, time from exposure to time of onset of symptoms, can be up to 14 days, which is why when we talk about isolating ourselves for 2 weeks, it's to make sure that if we're afraid we were exposed, we should see clinical signs somewhere within that 2-week period if we're going to. Now, one of the things that's particularly challenging about this virus in terms of control is that mostly this outbreak is driven by people who are sick, who are coughing and sneezing and spreading those droplets, okay? That's the biggest factor in terms of spreading this virus. However, this virus appears to also be able to spread even when people are asymptomatic or not showing any clinical signs. And that makes it really tricky because we don't always know who's infected. Somebody could look and feel perfectly healthy and still be infected with the virus, and importantly, still be able to spread that virus, to transmit it. So we have asymptomatic shedding or asymptomatic spread, which makes this particularly tricky. And it matters in terms of how we manage ourselves and others during this outbreak. Okay. So what can we do to limit the risk of us getting exposed? We're at a situation right now, and everybody knows we're in a state of emergency in New York and many cities in the United States, and clearly many countries are dealing with the spread of this virus. What can we do to protect ourselves as individuals? And then how does that factor into how we protect our community? Because remember, we're all part of the chain or the link of infection. So either you're spreading this virus and contributing to its spread, or you're protecting yourself and therefore not contributing to its spread, which ultimately helps slow it down. So that's why it's so important that we keep ourselves healthy, because we all matter. And the other part of that, which is good news, is that we all have a lot of power to affect this outbreak if we work together and do the right things. So what can you do? Number one, stay calm, don't panic, and stay informed. Okay, you're here because you want to stay informed, but tell this to all your friends too. It's really important to get the facts and understand the science behind this outbreak. And those facts are growing every day. Our knowledge about this outbreak is growing every day. As more and more research studies get published, as we have more and more experience with cases, we're learning a lot more about it. So that's just true anytime you're dealing with a new disease. But the danger is there's a lot of misinformation, a lot of bad information out there. And a lot of it is circulating around social media or even by word of mouth. And that can be really dangerous, because if people start believing things that aren't true about this epidemic, it can end up getting more people infected and cause more illness and death. And we want to avoid that. So the important thing is to find trusted sources of information. And I'll just name 3 of them now, which I think are important. And we can post this information along with the webinar. But the first one is the New York City Department of Health. Okay, New York City Health puts out really good information about how to protect yourself and your community, and also facts and numbers about cases in New York City and New York State. The other is the New York State Health Department. Third is the CDC, the Centers for Disease Control, which is our federal public health agency. All 3 of those agencies have latest information that's updated regularly and has really good facts. And if you're interested in international information about this, global information, then the World Health Organization is reliable as well. And if you haven't done this already, if you text COVID, COVID, to a number, we'll publish this 692-692, that's the New York City Health Department, you'll get alerts and updates anytime there's important news about policy changes or new information about the virus. So I recommend that you do that, and they're putting out really good information. Okay, so trusted sources of information. Then, what are the tools that we have to protect ourselves? Number one is social distancing, all right? Limiting your activity with other people. So already you've known that group gatherings have been canceled, schools have been canceled in New York City, and this is happening in many cities and states around the country, and some countries around the world have closed down events and closed schools and any non-essential services. It seems drastic, but these are really important measures in terms of limiting big groups from getting together where there's lots of opportunity for this virus to spread. And we all know that kids are notoriously susceptible to picking up diseases and bringing them home to the family. And so that's one reason to close schools. Now, good news is, and we're still learning, children seem to get much milder disease when infected with this coronavirus. They are able to be infected. Kids can get SARS-CoV-2, and they can spread it to other people, even if they look perfectly healthy. But fortunately, they have relatively milder disease compared to older adults. But schools have closed. People are being encouraged to work remotely or work from home if possible. That's really important too, because the risks associated with getting exposed to this have everything to do with time and opportunity. So it's one thing to be in a room with somebody who's sick with COVID-19, but the more time you spend with that person, your risk goes way up. So where do we spend the most time? At home and in the office. So being in an office with people who are sick is really dangerous. Being on the subway can be, but we spend relatively little time in transportation. But we still now want to avoid public transportation just because so many people can get up, use it, and the potential for exposure is high. So working remotely removes the commute, removes the office environment, and it really leaves the home environment. Now, another thing we've learned about this epidemic, primarily from data out of China, but we're starting to see this elsewhere, is that it is largely driven by family clusters, at-home transmission. That means that when a family member gets infected with this virus, the other family members tend to get it as well. And that's where most of the spread is occurring, not on the streets in public necessarily, but in the home. And so that's why when we talk about controlling, self-isolating, oftentimes the entire family will need to do it because the potential for spread is highest within the household, right? So social distancing is important. Hand washing, hygiene becomes very important. Washing hands. Now, your skin is a fantastic barrier to viruses. Okay, viruses can't get through your skin. So you can touch a surface that's contaminated with this coronavirus, and you're not going to get infected unless and until you then touch your face and allow the virus to get in through your mouth, nose, or eyes. So even if you have virus on your hands, if you wash your hands with soap, which kills the virus, then that makes it safe. So washing hands whenever you come inside from the outside, washing hands before you eat, and also disinfection in the home, making sure you're wiping down surfaces that have frequent use. So handles on sinks, countertops, doorknobs, and that's true for buildings as well. And you want to avoid directly touching what we call high touch points, doorknobs, handrails on the subway, elevator buttons. Okay, carry with you tissues or paper towels that you can touch or hold something with and then immediately throw away as you move into a building. That'll protect you from getting stuff on your skin that you might accidentally touch your face with. Okay. So, and this virus is very susceptible to traditional disinfectants that you think of. Lysol products, bleach products, isopropyl alcohol, or concentration of ethanol above 60%. And so there are lists available publicly of which disinfectants work, but your standard household cleaners that contain alcohol or bleach are going to be effective and good to use. And then soap and water on the hands. Okay, or if you have it, hand sanitizer, but I know that's very difficult to find right now. So protecting yourself is important, but all of that's to say that who we really need to protect in our community are the most vulnerable, the elderly, those with underlying health conditions, and those who are immune compromised. And so by keeping ourselves from getting infected, we're going to protect others. So make sure you know who in your life and in your world are going to be vulnerable. And many of you probably have already stopped visiting parents or elderly relatives. Certainly don't visit nursing homes or communities that are full of older or elderly folks. Those have already proven to be very dangerous in terms of spread of this virus. We saw that out in Seattle, Washington. So we need to be very careful about not visiting relatives who are highly vulnerable. So we're living in a time right now where a lot of these measures are difficult and challenging and require a lot of commitment, but it is what is ultimately going to help us get through this faster and much better off. So it's important that we do these things. So what to do if you or a family member gets sick? Now, the first thing I want to say is there really should be no shame or guilt in getting infected with this virus. This virus is spreading fast. It's highly contagious. And as I mentioned already, it's very difficult to even know who is or isn't infected. And so people are getting exposed and infected. And the good news is it does typically cause a mild disease, but it means that we shouldn't feel embarrassed or ashamed to let folks in our community know that we are infected. So if you start to experience symptoms like fever and cough, you should consider the possibility that you might be infected. Now, you may not be able to get tested just because you have symptoms, because right now the hospitals are really prioritizing severe and critically ill cases, those that have to be hospitalized for testing. So even though more and more medical practices have the ability to test, you might get told if you try to go get a test to really stay home and manage this at home unless you have severe symptoms. And that's good advice, because just like we would get through a common cold or a mild flu at home, just taking care of our symptoms and resting, that's what we need to do with this virus as well, so that we don't increase risk at hospitals by showing up and possibly infecting others in waiting rooms or getting exposed. If we're not infected, then we have the risk of getting exposed as well. So if you start to feel sick and you take your temperature and you have a fever and you have a cough, you should assume that you are infected with this virus and start to take measures to isolate yourself, put yourself in quarantine, and we'll talk about what that means. If you are concerned you might have been exposed, you had lunch with somebody who tested positive 3 days later, right? I hear this a lot. You do have the possibility, it is possible that you were also exposed, so you should self-quarantine and monitor yourself daily. Take your temperature twice a day, morning and evening, see if it rises up above 100 degrees. If you start to develop a cough, those are signs that you may very well be infected. But even if you don't have any signs or symptoms, because of that potential exposure, you want to isolate yourself from others and wait out that 14-day period just in case you're one of those asymptomatic cases where you feel fine, but actually are infected and could potentially infect others. All right. And this idea of self-quarantine is very abstract, right? Most of us haven't had to do that, to isolate ourselves, for 2 whole weeks. It's very difficult, particularly in New York City apartments. I have the same situation here. But some of the things that you think about when you're doing this, isolation means really isolation. And to the best of your ability, it means identifying a room in your house that you stay in, a bedroom. And if you have more than one bathroom, just use one bathroom, dedicated bathroom, and disinfect it regularly. You should not have contact with the other family members if you can avoid it. All right, they can bring you food, leave it outside the door. You should have a garbage pail for tissues that you might blow your nose in, put it in a lined garbage pail, a plastic bag, tie it up, and make sure that it can be disinfected on the outside, and then either you throw it away or have somebody throw it away for you, but it has to be disinfected on the outside. Otherwise, you do it. If you have a surgical mask at this point, once you are sick, that's when you wear it to avoid spreading droplets to other people. So masks or even a bandana that covers your face can reduce the amount of droplets coming from your mouth if you're speaking or coughing. That can be helpful, but if you do wear a bandana or a washable mask, you have to make sure that you're the only one handling it and you are washing it with hot water and detergent regularly so that you can keep it clean and prevent others from coming into contact with it. So isolation means you don't leave your room, you don't leave your apartment, and if you need to get groceries, you have somebody else do that for you, either delivery or have a friend looking after you bring them over. Okay. If you have pets in the house, you're going to also want to limit your contact with pets because while there isn't strong evidence yet that dogs and cats do get this virus, cats are susceptible to it potentially, but more importantly, pets can act as a mechanical vector for spreading this, which means that if you have a contaminated hand and you're petting your dog or cat or kissing them and you get saliva on their fur, the next person who pets them may get exposed to this virus. So you want to treat your pets like family members, which you probably already do, and distance yourself from your pets too, which is difficult, I know. But that's just for the 14 days while you're in quarantine. Okay. If you start to have severe symptoms, you should call a doctor, consult a doctor, and determine whether you need to go in to be seen either by that doctor or in a hospital. Okay. But as of now, only severe cases are being recommended for testing by New York City Health Department. Now, our ability to test patients is increasing, but because this virus is spreading so rapidly, the best way New York City and New York State are managing cases is to recommend that everybody manage their illness at home unless it's severe. Okay. Now, how do you protect your neighbors? How do you keep the rest of your building safe? This is the last thing I'll talk about, and then I'll stop for questions. Organize, communicate. Okay. If you live in an apartment building that is a co-op or has some kind of organization or leadership, develop a plan together of how you're going to develop protocols to disinfect the building. Okay, you should increase cleaning and use disinfectants on the door handles and the common use areas. Have a plan for communication. If you or if anyone in your building is exposed or thinks they're exposed and they're quarantining, make sure that's communicated to everyone in the building. If they know they're infected because they have symptoms or they've been tested, communicate to that building. And make sure that you have apartments that are looking out for each other, so that if someone in one apartment or a family has to self-quarantine, there's another family that will help them with shopping, help them with anything external that they need. To give you an example from my own building, I live in a co-op with 15 units, and I live in a complex with 11 buildings. So what we've done is, fortunately, 2 years ago, we established a leadership council with representatives from each of the 11 buildings. So we immediately convened a meeting. We discussed protocols for how we want to communicate facts about coronavirus. So we're using a lot of flyers from the CDC and New York City Health, posting them in our lobby, but we're all using the same information, so everyone's hearing the same thing. Every officer is being debriefed and having meetings, virtual meetings via Zoom like this with their building. And they have a plan for what to do if anybody is infected. So in our building, we're partnering apartments on the same floor. So we have 3 apartments per floor. We're connecting everybody and saying, right, if any of you have to self-quarantine or isolate, the other 2 apartments are going to help you and look after you and bring you things that you need. And if we can do that, then we know that we're all working together. There's certainly no shame in having to do this. This is a huge benefit and help to everyone around you. So everyone's happy to know if you're infected or think you are, simply because it's going to help us all. So it's really important to communicate and have a plan. I forgot to mention the kinds of things you should individually prepare in your homes. And there's a lot of run on the supermarkets and run on pharmacies, but really the things you need to prepare for are having prescription medications. You want to have about a month's supply of whatever prescriptions you might be using in case you can't go out. And the second thing is to make sure you have cold and flu medication, just over-the-counter stuff, okay? Cough medicine, NyQuil or Dayquil, something to treat the symptoms in case you do get sick, enough to the point where you'd want to control your fever or control your cough or just feel better, symptomatically. None of these will cure you of the virus, but they can help you feel better while you're getting through it. Okay, so those are the kinds of things you want to have supply of in your house, and you may want to have some food for a few days, particularly if we have a stay-in quarters order, by the city or by the state, which will prohibit people from going outside other than essential food shopping and things like that. You'd want to have a few days of food supply, but really there's no need to run out and buy every roll of toilet paper in the city. That's just not something that should be disappearing. And hand sanitizer will return at some point, but that's what you need. But the key thing here is to have a plan and to help each other, okay? Because we are all in this together. So with that, I think I'm going to end there, and Jessica, hand it back over to you, and we can take some questions or discuss things further. But thank you very much for your attention. I hope this was helpful.
Great, this is fantastic. I took pages of notes here. So just a reminder, we already have a few questions in the chat, but if you'd like to ask a question, along the bottom there's a chat icon. You can click that, or if you'd like to raise your hand, again, click participants, and on the right bottom hand corner you could raise your hand. So we already have a few questions, so I'm going to turn it over to Mia to help moderate.
Sure.
Hello, everyone. I'm Mia. I'm going to read a few questions that people have sent in already. And then, like Jessica said, feel free to raise your hand or send them to the chat. But our first question is from Nancy. And her question's regarding the reports that certain anti-inflammatory drugs make people more susceptible to the virus or make the illness more severe. She's wondering if these reports are true, and if so, would taking her steroid asthma inhaler, which she takes twice a day, would that be included in that class of drugs?
Okay, so some anti-inflammatories, particularly steroids, can cause immune suppression. And so it is possible, and I haven't seen studies on this, so I can't tell you specifically which drugs or at what dosage, but if you are on steroids over a long period of time at a high enough dose, that can actually, cause some immune suppression. So that's something to be aware of and talk to your doctor about. Things like over-the-counter Advil, ibuprofen, or acetaminophen, or aspirin, those, if you're taking those acutely for inflammation or pain, or you're taking them over a short period of time, none of those should cause you to be more susceptible to this virus, as far as I know. But I haven't seen studies particularly suggesting that anti-inflammatories cause you to be more susceptible to this virus. but steroids could potentially do that if you're on them over a long period of time.
Thank you. Our next question is from Mitra from Jackson Heights. She's wondering if we have parents who are in rehab facilities or in nursing homes, if we're able to, should we be trying to get them out?
That's a tricky one, because you would only want to get them out if you had somewhere safe to move them, and moving them could put them at risk as well. Nursing homes should be safe, particularly now that there's really strong enforcement of not having visitors. So I believe there are no longer visitors coming into nursing homes, or there shouldn't be. So as long as that's the case in the nursing home where your relative is, they should be relatively safe from this. The risk of moving them somewhere is they won't receive the care that they do receive in the nursing home. And, it could be really tricky in terms of the management of their risk. So it could vary individually, but those are the considerations you want to think about.
Thank you. Our another question is, can you get the virus twice?
That's a great question. We don't have a lot of data yet to know whether people do actually get reinfected, but it's a common question. If this virus behaves like other viruses, and it seems to be, that when you're infected, you develop antibodies against it, and that should confer protective immunity, meaning that when you recover from this virus, you should be resistant to reinfection. There have been some reports of people having positive tests and then a negative test, and then a week or two later, another positive test. And part of that, it's believed that this is because of a false negative test result, meaning that the test, you were never truly negative at the point you got the negative test. And that's because the test that's commonly used is called a PCR test. And what it does is it detects pieces of genetic material from the virus. And pieces of genetic material from the virus when you've been sick can stay in your system and be detectable by this test for weeks after you've recovered. It doesn't necessarily mean, though, that you are still infectious or even infected. It means that there's remnant parts of the virus, and the test happens to be very sensitive. So it's unknown, but it's assumed from what I've been reading that that's primarily why people think reinfection may have occurred, is just simply false negative tests. And more commonly, it's thought that you would be immune once you're infected, and that's probably going to be the case.
Thank you. Next question is from Paul. He's wondering, one, do you suggest wearing a mask when you're just out in the neighborhood getting groceries? And what are your thoughts about something like a shelter in, like what San Francisco ordered?
Okay, so when to wear a mask? Masks are useful because they can prevent exposure to the key areas, your nose and your mouth. Now, wearing a mask still leaves your eyes vulnerable. And also, I see a lot of people wearing masks incorrectly. You often see masks covering the mouth, but not the nose. And that's really important. So if you're going to wear a mask, then it should cover your mouth and nose. Now, the general recommendation is if you're healthy, you shouldn't need a mask, particularly if you're practicing social distancing or physical distancing. If you're keeping that 6-foot separation from people, you really don't need a mask. Masks, because especially they're hard to find right now, masks are desperately needed by healthcare providers, by our first responders who are dealing with patients on the front line. So the guidance that I typically see and what I recommend to you is not using masks unless you're sick. If you're sick, masks are really important because if you're going to have to go out in public while you're sick, it will keep you from spreading the virus to other people. So that's really where masks are going to be most useful. And in the home, if you're in quarantine because you're sick, wearing a mask in the home can protect your family members.
Thank you so much. I have another question from Rebecca. She's wondering if we should be disinfecting our groceries. And if so, how so? Should we be disinfecting our vegetables and other produce from the grocery store?
Here, okay. It's a good question. Now, it is true that the virus, if an item in the grocery store was handled by someone who has saliva on their hands and virus, it's possible that that virus could survive for a period of time on that item. But it's really difficult to disinfect a lot of things we're going to buy from the supermarket. Particularly, we're washing produce, but the fact that we're handling it and moving it around, or boxes of cereal, it's just going to be tricky. So one strategy could be that if you're going to the supermarket, that you could wear gloves when you're handling things in the supermarket, but obviously you're bringing those items home. So there is going to be some degree of risk, but I think that the risk is fairly low in terms of bringing virus into your household from the supermarket. It's hard to quantify that risk. It's hard to put a number on it or say, but I think that, disinfecting everything you're buying at the supermarket, it gets to a point of being difficult and impractical. Now, look, if you have alcohol wipes in your house and you can, sort of swipe it around cereal boxes or dry goods as you're putting them into your cabinet and then wash your hands afterwards, that's not going to hurt, and it might not be a bad idea. But again, I really couldn't quantify the specific risk of items you might bring home from the supermarket.
Thank you. Would you be willing, this is another question from Rebecca, would you be able to share your co-op safety plan and including the cleaning protocols that you've used for common areas?
Absolutely, be happy to. I'll talk to Jessica about the best way to do that, but happy to make that available.
Great, thank you. One more question. Would you be able to give examples of the differences between a mild versus a moderate or a severe case of the virus?
Sure. So a mild case would be, again, it's a dry cough. So the most common symptoms are cough and fever. So fever is objective. You can measure that with a thermometer. And the guidance is that anything over 100.4 degrees Fahrenheit would be considered a fever associated with this virus. But lots of things can cause fever. And we haven't talked about this, but I do just want to mention that we're in the middle of flu season. There are lots of other respiratory viruses around. So just because you're coughing and have a fever isn't a guarantee. But for practical purposes, we really do want to take that as an assumption that you may be exposed to this. So it's the combination of cough and fever. A mild cough might be just a dry cough kind of thing. It's not going to be very mucousy or productive. We don't generally have a big runny nose associated with this virus. It's possible, but it's not common in the majority of cases. And along with fever, and those symptoms will last for 7 or 8 days as you're recovering. Mild cases take on average about 2 weeks for full recovery. A more moderate or severe case could take anywhere from 3 to 6 weeks for recovery. So in a severe case, you're going to get a very sudden onset and severe pneumonia-like symptoms, which means tight chest, hard to breathe. You're short of breath, doing things that normally shouldn't make you short of breath, a few steps, staircase, that kind of thing. You'll have a persistent cough that you can't stop, coughing fits. You'll certainly have fever associated with that. And if you were to be examined on x-ray, you'd have a typical, pneumonia-looking lung, which means you'd have lots of fluid in your lungs that make it difficult to breathe and get a good breath in. So the more severe cases will have those signs, harsh, persistent cough, tightness in the chest, shortness of breath, fever, feeling very miserable, heavy flu-like symptoms. And at that point, if you're experiencing severe symptoms, that's when you want to call your doctor and get advice about going into a hospital to be treated and seen.
Thank you. Another question, how long does the virus remain on different surfaces? So metal, wood, cardboard versus fabric. Does sun or temperature kill the virus? And what other conditions can help kill the virus faster besides washing or disinfecting, if any?
It's a great question. We still are getting data in about how this virus survives on surfaces, but there is a study out from the NIH looking at how long this virus can be cultured off of metal, specifically steel and plastic, and that's 2 to 3 days. 2 days for metal, 3 days for plastic. So this can last quite a long time on surfaces under room temperature conditions with no direct sunlight. Now, things outside in nature that kill viruses are ultraviolet radiation, so sunlight, and desiccation, which means drying out. So in hotter, drier climates with less humidity, viruses tend to be more fragile in the environment, and likewise when there's a lot of direct sunlight. So none of that matters so much in an indoor environment, but certainly on surfaces that are outside, that can matter. And it probably is a good time to bring up the notion that many people have talked about, the idea that come warmer weather in spring and summer, that this will just disappear. I just want to emphasize that we have no data to support the idea that this is seasonal or that the severity will decrease as we get into warmer weather. That may indeed happen, but right now, there's nothing to indicate that that's the case. And so we're still learning a lot, particularly as this virus is spreading in the southern hemisphere, which is currently in warmer weather. But also, this virus is going to stay with us and persist for months to come. So it'll still be around this summer, and we'll start to learn more about how the rate of spread changes as we do get to warmer weather. But as of now, I wouldn't say that we know enough to know that this is going to be seasonal.
Great, thank you. I want to be mindful of time, but we do have a couple more questions.
Sure.
One question is, how concerned should parents be of transmission through things like swings and slides if kids are still wanting to go to the park?
I think that going to the playground at this point is really something to be avoided. Playground items are right in that category of high touch surfaces, just like a subway handrail. Especially with kids, they're handling slides and slide handles and ladders and swings, and it's very difficult to stop them from doing that. And this would be particularly high risk in terms of surface transmission. So even if you had disinfectant with you and you were diligent about hand washing, you're just better off avoiding playgrounds at this point, which I know seems really difficult given that kids are home from school and often trapped inside. But playground equipment particularly represents an opportunity for transmission.
Great, thank you. And now I have a question from Christina, who raised her hand. I'm gonna let her ask it and unmute her and give her the option to be on video.
Hi, I'm Christina. Thank you so much for answering so many of these questions. Obviously, I had most of these, and I'm sure that other people had similar questions. My question is about what other things can transmit. So let's say I have gloves on and I touch something. So I remove my gloves and it's fine. But what if I brush up against something on my clothes? Should I be careful to not come into my apartment with clothes that I wore outside? What precautions should I take with my clothes? Or if you have long hair, I've been seeing that some nurses and doctors in China are getting their hair cut. What's behind this?
So the answer is really it depends. Now, there's some data about persistence of the virus in fabric, and I'd actually have to go back to the studies to tell you specifically how long it lasts. But it really has to do with what exactly you're touching, and if you're practicing good social distancing and physical separation, there really would be minimal risk that you're going to brush up against something that is probably a high-touch surface. It tends to be the things we grab with our hands, and so if you brush up against let's say a pole on the subway, and it's on the outside of your coat, chances are the virus is not going to last very long on that. And I'm happy to go back to the studies that are available and see what it says about fabric. But from memory, it's less than plastic and steel. So while there's some risk, it's minimal risk. And if you feel that you have brushed against something and you want to keep your coat, separate in a place at home where it's not going to be touched, you could either, if it's washable, you could wash it with hot water and soap, and that should clear away any of the virus, disinfect it, or you could spray it with Lysol, which could help to disinfect it, or simply, after about a day's time, probably it's going to be fine if you're concerned. But, brushing up against something is probably a little less risky depending on what it is, particularly if you're cognizant of distancing yourself from others and avoiding high-touch surfaces. Was there a second part to your question, or was it primarily fabric? Oh, hair. Cutting hair, again, distancing yourself from others should protect your body and your hair. Certainly in the same way that we talked about pets and their fur, your hair could carry droplets on it. And, it's possible that in touching your hair, you contaminate your hand unknowingly. So it's not to say you have to go cut off your hair, but it is to say that you want to be cognizant, again, of keeping that distance and remembering that, anywhere on your body could potentially pick up saliva droplets. Now, certainly when you shower and use shampoo, that's going to kill any virus and wash that away. So one strategy is you might want to practice when you come in from the outside, taking a shower if you're concerned that you have long hair and that might be an exposure point. But I don't think you need to necessarily have short hair. It's just something to keep in mind.
Great.
Good question.
Thank you. We have one last question, and then I'll hand it back over to Jessica to close us out. But the last question is, we're hearing reports that we'll be in this period of social isolation until July, and I know people are hearing from a lot of different things. Do you have any thoughts or insight on that?
Yeah, this virus is so transmissible, and it is moving through our population so quickly that we have to undertake pretty severe measures right now. We have to go all in to try to slow this down. And we're probably beyond the point of containment. We are beyond the point of containing this virus. We're now at the point of what we call mitigation, which is slowing the spread, doing everything we can to prevent it from, just rolling through the population. But over time, it is going to roll through the population and lots of people will be infected. And the better we are at controlling it, meaning practicing isolation and really limiting opportunity for spread, that means the longer the virus is actually going to be with us. Now, it will find ways to spread, but we're probably not going to be able to stop it altogether by what we're doing, just slow it down significantly. And that's why people are talking about a 3 to 6 month horizon, at least, for us getting through this. So, of course, things change very dynamically. There's new information daily. But the other thing we didn't talk about that is worth mentioning is, you might ask, what are the numbers in New York State or New York or the United States? And, just this afternoon, there were 500 new cases developed. So there's two things to bear in mind about numbers you might read. Number one, we're probably only finding anywhere from 1 to 10% of all the cases there really are. And part of that is we were very slow as a country to implement testing. We had very few laboratories in the beginning that were able to do testing. So we didn't detect most of the cases here. So the numbers started out small and now they're ramping up because we have many more labs that are capable of testing. So if you start to see numbers rising rapidly, some of that will be the result of more testing being done. But also because this is a disease that's largely mild and sometimes asymptomatic, there will simply be a lot of cases who don't get tested and therefore don't get counted. And so there are many more cases than we realize. And so that's why we have to operate under the assumption that this virus is spreading rapidly and it's here in the community. It's pointless to think about, which neighborhood has it been reported in or not reported in, because that means nothing. We have to assume that it is, throughout New York City and that there's equal risk wherever you are in terms of getting exposed. And so this is going to take a while for us to get through. We're going to get through it. We'll be okay. But it's obviously having profound impacts socially, economically, and psychologically. It's very difficult to practice this kind of isolation. So it's important, too, to maintain whatever sense of community that you can, whether it's through virtual chats. We're fortunate to have access to this kind of technology that's pretty easy to do via your phone. You can have video chats. So try to stay connected to people virtually as best you can, because mental health will be very important as well. But we do have to prepare to be in this for the long haul, which means social distancing, hunkering down. There may be a stay-in-place order that gets issued, in which case that'll just mandate that we don't go out. And continue to educate people. Some people still don't really think this is a big deal or that it's overblown, and they couldn't be more wrong. So not a need to be afraid or panic, but it's definitely a need to understand this and understand that the measures that are being put into place now are necessary and probably should have been done sooner. But here's where we are, and they're going to be effective, and we all play a role in that. Thanks.
Great. Well, thank you, Dr. Epstein. This was so informative, and I know there's more questions. Can you just repeat the 3 sources that you feel are the best to share to look up information?
Absolutely. Primarily New York City Health Department and the CDC. So that's newyorkcity.gov, nyc.gov, cdc.gov are those two. And then I mentioned texting COVID, COVID, to 692-692. And that will set your phone up to receive alerts from the city, which could be about new policies that are put in place, new rules, new information. So it's a great way to actively receive information from the city.
Thank you. I want to give you a round of applause. This was really, really informative. Thank you for keeping the calm as well, but giving us the tools, information, and resources for us to stay safe and keep our community safe. Just a reminder for folks, we did record this, so we will release the recording for anyone who would like to share it or watch it again, and we will include subtitles in Spanish, so it's accessible to our Spanish-speaking community. And please keep up to date with the campaign. We actually plan a number of webinars on different topics, mental health, homeschooling, how to take care of yourself, practices to take care of yourself during this time. So please stay involved, visit us, and follow us on social media. Everything is at VoteJGR, so Facebook, Instagram, Twitter. So thank you, Mia, for moderating, and thank you, Caitlin, for live tweeting. If folks want to review the tweet, it's hashtag JGR COVID webinar. Hashtag JGR COVID webinar. She did an awesome job. So thank you again, Dr. Epstein, and everyone, please stay safe, keep your distance, wash your hands. Don't touch your face, which is very hard for me, and don't hug people, which is very hard for me. But please stay safe and healthy. Thank you.
Good night, everybody. Thank you.